Clearly, this 50th anniversary is providing USAID employees and partners around the world with an opportunity to pause and reflect on what we have accomplished on the challenges before us. For example, over the past half-century, the world has clearly seen more progress towards economic prosperity and human development than any other period in human history. We clearly need to capitalize on innovations being developed and put in place every day in this region by African-led and managed organizations. We need to reach out to these organizations, build on their expertise, and ensure that regional solutions address regional challenges.
Some of the work around gender-based violence, issues around fistula policy, which are very sensitive areas, and you find many times our member states do not know or do not have the capacity to see how to move this forward. And through support of USAID, we've been able to come up at least with prototype policies to help our countries know how to implement these extremely sensitive areas of health.
Using technical and financial support from USAID, the Regional Center for Quality of Healthcare, together with partners, have been rolling out the Helping Babies Breathe training at a regional and country level so as to strengthen health worker skills in essential newborn care, including resuscitation. It is a low-cost simulation doll which is designed to simulate breathing by the help of pressing an extension bulb that it has. This helps the chest move, and it can show that one is able to breathe, the baby is able to breathe when one is doing this. Using this neonatally, we are also able to train on essential newborn care practices. Filled with approximately 3 liters of water, the neonatally, which is a flexible baby kit, has the feel and weight of a live baby. Since February 2011, the Regional Center, together with the partners, have been able to train close to 400 health workers in 14 focus countries in Africa, so as to strengthen their competencies in newborn resuscitation.
EXA uses the policies to influence decisions within the countries. The ministers of health of EXA normally work through passage of resolutions which are being implemented by the country's member states and also by the Secretariat. We have 2 policies, one on fistula and one on gender-based violence and child sexual abuse. These policies were launched by the health ministers last year in October, having worked on them for the last 2 years. And after that launch, the health ministers made some implementation resolutions which are going to help to roll out these policies within the member states. One of the countries where the EXA has worked to roll out the gender-based violence and child sexual abuse is Zambia. And now it is time we are going to use the next few years to ensure that these policies are implemented in the member states. Thank you very much.
We have a map of Africa. The map shows the geographical reach of the roads project. You can see the 2 dots at the top are sites, the roads project sites in Djibouti, and it goes all the way down to Mozambique. The roads project works across 8 countries, and we have set up and established over 40 safety stop communities which provide quality and integrated healthcare services to mobile populations like truck drivers and other mobile populations.
Micronutrients have been and are still a major health concern in our region. Vitamin A is an essential micronutrient which promotes good health and promotes good eyesight. It is also very important because it helps our bodies to fight infections, especially in children. And this is why EXA with USAID have been working with countries in the region, Malawi, Zambia, Uganda, Tanzania, Kenya, to help them fortify their staple foods.
This area was lagging behind with hardly any children born with HIV infection getting care that was required to enable them celebrate the first, second, third, or fourth birthdays. 4 years down the road, we recognize that actually everybody else out there, all healthcare providers, program implementers, didn't have any tools they were using to actually provide the much needed care. So USAID East Africa went ahead and supported this network, ANECA, to develop a handbook on pediatric AIDS in Africa. ANECA and Regional Center are very proud that USAID East Africa has supported them to actually be part of this movement by launching this new tool and material that is going to enable the various programs on the African continent to be able to work towards achieving this goal.
So having a group of people, physicians, nurses, midwives, community health workers, community members, just to go in an ambulance, you can see it somewhere here, go down to the village and offer services. Not only injectables, but also long-acting and permanent method, for people who are really in need. But also making sure that those people, victims of sexual and gender-based violence, they have access to social, psychosocial, and medical services exactly where they need them.
With his support and related support from determined donors, including USAID and the government, and highly committed personnel, a number of things have been achieved now. The whole country network is GIS mapped. You have conducted an MDR-TB survey and surveillance system exists. A national external quality assurance program has been implemented covering all the 1,007 units. New and up-to-date TB diagnostics have been implemented, including LED microscopy, MIGIT, HAIN, GeneXpert, and all the cutting-edge diagnostics. And they have improved the infrastructure. Now the National TB Reference Laboratory is the BSL-3, and there are 3 others in the country. And we are proud of 8 culture labs spread through the country. And we have been training in the region and beyond. And we now have a highly knowledgeable, highly motivated human resource of 30 people. And as a result of these achievements, the National TB Reference Laboratory has been designated a supranational reference laboratory, second only to South Africa. And I've just received that designation.
And the basic idea of modern quality improvement is the application of the scientific method to improving healthcare processes themselves. I'm going to give you an example of the kind of results that we are seeing in East Africa, specifically here in Uganda, that illustrate that not only do these approaches apply well in East Africa, but in fact the results being generated in East Africa are in fact superior in scale and in improvement to those in the US.